For the arm region, what you can actually do here is you can actually hold down the wrist and have them try to lift up. So you get a little bit of resistance. Relax. Okay, resist. There you go. Relax. Resist. Relax. And then you can also internally rotate it like this and have them trying to externally rotate, bring it out like this. Okay, go. So you can go across the forearm, the bicep region. Okay, the ratchet technique, like we showed you before, what we're going to do for this one, for the extensor region, we're going to actually flexion slide, extension nothing, flexion slide, extension nothing, flexion slide, extension nothing, flexion slide, extension nothing. Or we're in continuous, so a little bit of flexion and slide all the way up then, okay? But with the flexor regions right here, flexor's flat, extensor's hairy, that's where you can remember that. So extend, slide, flexion nothing. Extend, slide, flexion nothing. Extend, slide, flexion nothing. But again, median nerve right in the center, and if their fingers tingle at all, make sure you back off the technique then. Then you can also just use a broad area over the whole area, and just do a slow glide over the forearm. So especially weightlifters who would incorporate a lot of techniques into there. Okay, for the bicep region, what we're going to do here is extend, slide, flexion nothing. Extend, slide, flexion nothing. Or you can just do little ones with just your thumb. So you can isolate it a little bit easier. Or just one continuous flow up the arm. Okay, next one we're going to do a rotation. So what we're going to do for this one, I'm going to externally rotate it like this and go across like this. And again, you can have them do resistance with all these techniques too. Okay, or you can go the other way. So you can go across. Let me get this angle. So again, like this, bring it down. So medial rotation or external rotation, glide it opposite then, okay? But again, if you want to go deeper, just go a little bit slower. Just watch your reactions, watch your breathing, watch all that. Okay, next one for more of the forearm, what you're going to do is just go down, and a lot of times their fingers will open up a little bit the deeper you go. Okay, so you can see the fingers are opening up. So just because you're contracting the muscles a little bit there. Then more for the palm area. Pinky, pinky. Wrap these three fingers, wrap these three fingers, and spread. You can even do a ratchet. You can extend the wrist going down like that then too, okay? And also for the palm, you can actually just place it on the table. Just kind of circular friction right in the palm. Usually handle a little bit more pressure there. And for the wrist, again with stretching it, sometimes you want to actually pull the wrist and then perform flexion. Because sometimes when you just go like this to stretch it out, it's not getting the ideal stretch. So what you're going to do is you're going to pull and then flex, like this then. Or you can pull and extend. Okay, so pull and extend. And this is actually radial deviation like this towards the radial bone. This is ulna deviation right here. So radial, ulna, flexion of the wrist, extension of the wrist. This is finger extension, finger flexion, opposition like this. Okay, elbow flexion, elbow extension. Okay. And then this is external rotation, internal rotation like this. So those are some of the actions of the arm. Also protraction is when they're lifting it up. Retraction was when they're bringing it down then, okay? Okay, so I'm going to stay right here and actually have them try to push up to the ceiling. And you can actually go down the forearm region for a little bit more pressure then, okay? And if you want, you can actually kind of have them rotate your forearms. So just rotate your hands around there. So kind of like a snake bite, but it's a little bit of a movement, so it's not going to cause too much kind of pain then, okay? Okay, now let me do a little bit of a stretch right here. So I'm going to hook it here, hold it down. You can actually go down the triceps, get a little bit more pressure. And what you can do is actually have them try to lift up their arm, get a little bit more pressure right in that region. So the triceps really get neglected a lot. You can even have them hold their hand, put it right underneath their head. Have them try to lift up their elbow, put a little bit more pressure, so you can get more of the tricep or bicep that way too. Or you can bring the arm over here like this and actually go down more to the lateral side of the arm. You can make a ratchet technique out of this too. Bring it down, ratchet it. Bring it down, ratchet it. And you can even have them hold on to your wrist. Okay? Lift up and then have them try to push down on the table. So you can actually go up the whole arm then, okay? Relax. Okay, then push down. There you go. And you can even have, you can hold on to the wrist here, both, extend, go down this way too. But if you think you're putting too much pressure on the wrist, that's when you want them to actually hold on to your wrist. You can extend it too that way. Okay, now right for the pec region, we're going to do a little rotation here. So right here, I'm going to rotate. So I'm going to rotate like this, and rotate around. So I'm doing internal rotation like this, and I'm just rotating my fist around this area. Otherwise you can plant your palm, go right around there. Or if you want to do the other way, external rotation. So you remember it's a little bit bent, bring it around here like that then. Okay. But again, you can bring it at any different kind of angle, so just get used to it. So whatever angle works better for you, try to incorporate those